Governor Tom Wolf is painting a very dire picture of hospitals being stretched to their max.
Yeah, listen to this. Statewide, only 16% of adult ICU beds are left. And healthcare workers, they're at their breaking point. NBC 10's Randy Gyllenhaal live in University City with new perspective from a doctor right there on the front line. And Randy, he's got a warning.
Yeah, emergency room doctors are raising the alarm, trying to get the public to understand what is happening inside many of our hospitals here in Pennsylvania. You know, the staff, they say, is exhausted, working long hours, some of them even getting sick. But the COVID cases, they keep pouring in, and the governor is warning beds are running low.
If we don't slow the spread of this dangerous virus now, if we don't do this, the reality is that COVID-19 will overwhelm our hospitals, will overwhelm our healthcare systems.
In Pennsylvania right now, just 16% of adult ICU beds are available. That's because most of them are filled with COVID patients. More than 5,000 people are hospitalized today. In mid-September, that number was just 500. So the surge is clearly happening, and ER doctors say staff shortages could make it worse. Some overwhelmed hospitals already diverting patients. All of this basically means that the system is starting to buckle, making it harder for COVID patients to get proper care, and regular ER visits could be impacted too.
Just a few days ago, the hospital that I primarily work at was filled to capacity. I speak to my medical director every day, and today it was at about 150% capacity in the emergency department. We have tons and tons of sick COVID patients. We have tons and tons of sick non-COVID patients, and we're running out of places to put them.
You know, back in the early days of the pandemic, they would have been able to get help from other hospitals in different states, but COVID now surging everywhere. Across the river in New Jersey, they're seeing the most hospitalizations since May. So what can you do to help? Still the same simple rules we've been talking about: wearing a mask, keeping your distance, and we should note that it is possible more restrictions will go into place if we are unable to flatten that curve and keep hospitalizations from tipping over. For now, we're live in University City. I'm Randy Gyllenhaal, NBC 10 News. Count on it.